Okay, so now we're going to talk about NPN 101, the lifespan. Okay. So people are constantly changing from conception to death. Quality nursing depends upon a thorough understanding of developmental concepts. Developmental stages occur throughout the life, and they do influence health. So part of that is growth. Growth are those actual measurable changes in the physical size of the body and its parts. It's those numbers. It's that height, it's that weight, it's that chest circumference, it's that head circumference. It's all of those things that you can physically measure. The rate varies from periods of rapid growth to periods of slower growth. Those rapid growth periods occur most commonly in the prenatal, infant, and adolescent phases, and of course, much slower in the older adult. Development are those behavioral changes in skills and functional abilities. They are not easily measured. There's nothing concrete attached to that. Maturation, then, is the process of becoming fully grown and developed. It's those physiological as well as behavioral aspects. Maturation depends upon biological growth, behavioral changes, and learning. Each lifespan stage has certain goals that must be accomplished. These goals are usually developmental tasks, and they are the foundation for learning, future learning. Critical periods are those times of the most rapid growth or development in a stage of a lifespan. People are most vulnerable to stressors during this time, and each rate of development for each individual cannot be predicted. There are some factors that do affect growth and development, the first of which is heredity. This is not only the physical characteristics and body structure, but also predisposition to certain diseases. It's kind of the genetic blueprint for individual growth and development. The second thing that affects growth and development is the health status. If there is wellness, they progress through lifespan as expected. They meet those developmental milestones when they're supposed to be met. But if there is a delay in developmental milestones, it's most likely going to be because of illness or disability. Also, growth and development is affected by life experiences. The rate of growth and development is influenced by life experiences. In times when there are few sources of food, shelter, and health care, there's a higher risk for lag of growth and development. It only makes sense, right? The Great Depression, when there was a lack of resources for food and everything that was available, there was a lag of growth and development at that time. Also, culture. People master skills in each developmental period, and that's partly determined by their culture. An example of that is that in some cultures, at the age of 12 or 13, they have mate selections, and after that they're married and a child is born soon after that. In our culture, that's not so. That's not the way it's done most of the time in our culture, but in some cultures that is how they do it. Now in the next section they talk about dimensions and theories. I'm just going to give you the very basics of some of this stuff. You're not going to have to know the specifics about who the theorist was and what the theory was unless I specifically mention it, okay? I'm probably going to touch on it a little bit, but you're not going to have to know all of the hows and whys for it. Chronological age and developmental age are not the same, and that should be something that you understand. You understand that some people, especially because of illness or disease, have a chronological age of maybe 40. But because of something that has happened, their developmental age may only be that of a 10-year-old. Or you could have a child who is 15 but have the developmental age of a 5-year-old because of something that has happened. So remember that chronological age and developmental age are not always the same. Physiological dimension consists of that physical size and the functioning of each individual, influenced by genetics, nutrition, central nervous system, and the endocrine system. The psychosocial dimension consists of feelings and interpersonal relationships. It's important to have a positive self-concept for happiness and success. The characteristics of positive self-concept are self-confidence, willing to take risks, the ability to accept criticism, and not become defensive, be able to adapt to stressors, and have innovative problem solving skills. People who with positive self concepts usually believe in themselves and they set goals. People with negative self concepts have low self esteem, they lack confidence, they have difficulty setting goals, and they have difficulty achieving them. Now, the theorist Freud had the psychosexual theory, which identified sexuality as the underlying motivation for all behavior. He believed that all behaviors have meaning and that are repressed sexual problems in childhood that cause later problems in life. Okay, that's what Freud believed. And you just have to know that basic thing about it, okay? Now, Erickson believed that psychosocial development occurred throughout life, and the psychosocial theory, each stage has a task to be mastered. In the cognitive dimension, it's the way a person thinks and understands that shapes their perception, memory, attitude, action, and judgment. There's an adaptive process. Now, Piaget theorized that children learn to think by playing. He says that there are 4 stages of intellectual development: the sensory motor, pre-operational, concrete operations, and formal operations, and that each stage is characterized by the ways that a child interprets and uses the environment. Piaget believed that individuals learn to interact with the environment by assimilation, which is the process of taking in new experiences or information; accommodation, which allows for adjustment of thinking into new info and increasing understanding; adaptation, a change resulting from assimilation and accommodation. So you will have to know what the definitions of those are. And that moral dimension, it's that person's value systems. It's that moral maturity, the ability to decide independently what is right, quote unquote. Now, in this dimension, Kohlberg had the framework for understanding how people decide on moral code. He said that there were 6 stages, with each built on the previous stage and becoming the foundation for the next. He believed that we move through stages sequentially, but not everyone can reach stage 5 or 6. And if you look in the book at what the stages are, then you'll understand what stages 5 and 6 are. In the spiritual dimension, it's described as a sense of personal meaning. In the Latin, it means breath, air, wind. It refers to whatever gives a person life. Now, spirituality is a relationship with oneself, others, and a divine source or higher power. It's developed throughout life, and understanding spirituality is a basic to nursing. You have to understand what a person's spirituality is. Holistic care is providing care to the whole person, body, mind, and spirit. Nurses must know the growth and developmental concepts. They must know the interventions that are appropriate for each stage of development, and that growth and development knowledge becomes a useful guideline for assessment. You have to know when milestones are not being met, and you have to know what the interventions are, and that they become essential. Holistic care is of the utmost importance, because when you take care of people nowadays, you don't take care of just that body, just the physical side of it. You have the mind, that emotional side to it, and the spiritual side as well. And that, I'm going to preach for just a moment about this. This is where it is important to understand what those biases are, because you do not always agree with someone's religious beliefs and that spiritual side of it, but you have to be able to provide them with the support that they need to get them through whatever they're going through, physically with their body, sometimes mentally with that mind, that emotional side. You have to be able to give them what they need spiritually as well. And it doesn't mean that you have to physically give it to them yourself, but you have to be willing to find someone that can give them that spiritual part. If they are Catholic and you know nothing about Catholicism, find someone. There are people that come into facilities all the time so that people's spiritual needs can be met. all you have to do is make sure that person understands that that someone is coming to them. Make it a point to call the person, whoever the Catholic priest is that comes, or the person that represents the Catholic Church. Whatever you have to do to get that person what they need to have their spiritual needs met. And that is your job. It is, because you are caring for the person, body, mind, spirit. Just remember that. This next slide has a link to an article that I thought you might find interesting. It is not necessary. It is not something that you have to have for the exam, but it's just something that I thought might be an FYI kind of thing that you might find interesting, and that might give you some extra knowledge along the way. Next, we're going to talk about lifespan stages. The first is that prenatal stage. This stage begins with conception and ends with birth. It's a critical time in growth and development, and it has 3 phases. Okay? So the stage is the prenatal stage, and there are 3 phases of the prenatal stage. The first phase of the prenatal stage is germinal. Begins with conception and lasts to about 10 to 14 days. It's a time of rapid cell division, implantation of the fertilized egg to the uterine wall, and the CNS is already forming in this phase. The next phase is the embryonic. It's from week 2 to about week 8 after conception. It's a rapid differentiation of cells, development of body systems and growth, and this is the time when the embryo is most vulnerable to spontaneous abortion. The next phase is the fetal phase. This is when intrauterine development takes place from about week 8 to birth. It's a rapid growth and differentiation of body systems and parts as well. Now, during this stage, the significance of nursing becomes wellness. This is the primary environment that affects the prenatal growth and development, the uterus. So mom is responsible for sufficient nutrient supplies. Low protein consumption at this time could give high preterm and low birth weight babies. You have to teach the moms about nutrition, about self-care, and about routine screenings that are necessary. Blood pressure, urine glucose, albumin, and you have to assist poorer clients. Sometimes they don't have the resources that they need to buy the prenatal vitamins or to whatever it is. So you give them, again, community resources, links to things that they may need to ensure the best possible environment for their baby before, so that they have the best possible outcome after birth as well. And there is a link on here, again, to articles or some information, again, not necessary for testing purposes, but just something that I thought you might find interesting. Okay. We're going to move on to safety concerns, and then I'll talk about this picture. Safety concerns: anything consumed by mom directly affects the fetus. Nicotine crosses the placenta, interferes with oxygen transport, and any other toxins may result in fetal death, premature birth, retarded growth, or learning disabilities. This is a picture of a fetal alcohol syndrome baby, FAS. Fetal growth development is impaired, and it ends up having physical and intellectual problems with this baby. Alcohol is the most dangerous in the first 3 months of pregnancy, when the brain and vital organs are developing. The effects are permanent, and they do lead to retardation. Fetal alcohol syndrome is the leading cause of retardation. And then teratogenic substances. Anything that crosses the placenta and impairs normal growth and development is a teratogenic substance. Okay? Anything that crosses the placenta and interferes with normal growth and development.